Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Jocelyn Vega, Community Impact Director with the American Heart Association in Illinois. Jocelyn graduated from the New to Public Health Residency program in January 2025. Jocelyn, thank you so much for being with us today. Why don't you start by telling us more about your story and how you found the public health community?
Thank you so much. So first, I'm really grateful to be part of here ever since joining the New to Public Health opportunity. It's going to be like a few years now at this point. It's really changed my life, and a little bit about my public health just journey. It comes from a personal place, I think, like many of us. I grew up to immigrant parents and just like navigating healthcare at a really young age and just kind of seeing the genuine disadvantage that my parents, my family was in just because of like being uninsured or not being able to speak English and being low income. So it really starts from an early place in my life, but I never planned, like since I was a child to be in public health. That was a recent career development, and I'm so glad and it ended up being that way because I'm really happy now being in public health.
Oh, that is very interesting how our roots and our childhood impact where we are today, even if we don't plan on it all the times. It's where we're meant to be and who we're meant to become based on our upbringing. You talked a little bit about New to Public Health and how that helped kind of spark your work, and especially in your role at the American Heart Association. Talk to us a little bit more about your experience in New to Public Health and the work you're doing today.
Absolutely. So I just got to say, it's a hilarious story how I learned about the program. I was 1 week into my new role as a community impact director at the American Heart Association. And I just saw this email. It was like one of those emails that were forwarded, and it's like, you got to dig in there. And it's like, hey, there's an opportunity if you're, I love it, new to public health, right? You want to strengthen your background. Maybe you don't have previous career experience. And I'm like, wow, I really felt like this email was meant for me to, borrow some of your language. And ever since like I applied and when I wrote my scholarship application, just really taking that time of remembering what a difference it would have been in my family's life, my own life, if we had, just the best resources when it came to our public health for all families, all backgrounds, all zip codes, and that I now got to be a part of an opportunity to learn, to be part of that change, to bring that into my new job. So it was, as you said, like meant to be. And ever since I joined the program, it is like a long-term commitment. You get what you give to it. I have only grown so much, like within my role, within the impact of our team. And I work here in Chicago. And it sounds a little abstract because I'm not giving any specifics, but how I show up to work, how I show up to our partners, how I show up even to questions and gaps just has so much strength now versus confusion. Thanks to the educational experience, the mentorships, incredible leaders like you, Juliana, just like thank you so much. And happy to go into like the actual impact, but really it's been life-changing since I first applied.
Oh, that's so awesome to hear, Jocelyn. And I love when people really feel that confidence as they bring their work forward and being in those groups and really being intentional about what you're doing in your day to day and bringing people together. And I think that you do have some really awesome stories to share. So tell me a little bit about some of the work that you're currently doing in the community.
Absolutely. So I'll kind of tie this to like being a student to need a public health as well, because being able to like have all of the self-study resources, and everything is truly available, like the amount of readings that you have, the in-depth videos, the different perspectives that the teachings come from as well, whether it's from a public health department or looking at a case study, all of that. I got to take that into my own work as a community impact director at the American Heart Association. So being able to look at workflows at one of my clinical partners, and instead of being like, okay, this is the outcome we expect from them, because that's my job. I seek certain outcomes. We want to improve public health and blood pressure, etc. But after, being in just a few of the new public health classes, being able to take a step back and think about what are the various factors impacting a clinical care team? What are the various factors impacting the environmental health of a community member? What are the gaps? I will never forget the section on communication. So not only communication, how we're reaching, populations in need, but also communication resources that the teams need to talk to one another, to relay information back. The amount of time that I learned of how to improve like data storytelling. So instead of just like expecting my partners to give me numbers and results and etc., really thinking through who are all the people that make this story, and it's just data, right? And it just really improved my relationships. So that's a little bit how quickly I truly applied being in the classes, even a few weeks in, to my work itself. And to bring it back to your question of what is it that I exactly do, I just keep it really short. I'm a liaison for the American Heart Association for any clinical opportunities. So our federally qualified health centers here in Chicago, and community-based organizations. And it's all working towards improving blood pressure access and awareness in our communities. I specifically focus on the West Cook County, so Chicago, of course, so Northwest, a little bit Southwest, and then our western suburbs of Chicago. But I really want to start off, Juliana, with those examples of how quickly I applied the information, because it really, really improved my quality of work and the ways in which I wanted to show up better for our partners to really deliver those outcomes we were expecting.
Well, it sounds like by pausing and thinking about your partners in a very intentional, heartfelt way of like what is the parts that they need are
Mhm,
most concerned about or interested in, that actually increased your impact
mhm,
even
mhm.
further than going in with an impact focused mind. So I understand that you have really expanded your blood pressure hubs. Talk to me a little bit more about that project.
Yes, absolutely. So with the community, I guess like community facing side of my work outside, this is outside of the clinical work. We partner with incredible organizations of all sizes. It can be a church, a small pantry, a very established nonprofit that's been around 100 years, you name it. And we are really working with these partners to implement, we're calling them a community blood pressure hub. So think about having a space in your community where anyone can just take their blood pressure on their own, super low barrier to access, right? All I have to do is go, right? The machine is there. It's very simple. We're really just talking about, sitting down those extra 10 minutes before you take your blood pressure just to slow it down. And when you do take your blood pressure, it's just a click of a button, a receipt prints. And right now, it's really, really incredible. This is my first year really leading this initiative. We're looking at 22 on the west side of Chicago. So, when you think about zip codes, neighborhoods, already established routines, to have 22 locations all over the west side where, you know, there's not a lot of places where you can just go to check out your blood pressure generally, but now to have 22 in a concentrated area, um, it just makes me so thankful that I get to have this type of job and get to do something good, and increasing access to, unfortunately, a silent killer, and giving that power directly to community's hands. So thank you so much for asking about that.
Yes, that is so awesome to be able to have those devices strategically placed around the community, and what great partnerships to collaborate with when in spaces where people are already going as that, like in a trusted space as well. I think that's really important. So you were recently showcased during CPR and AED Week Awareness Week on Fox 32 Chicago News, right? How did that come to be and what has happened since then?
Absolutely. So I'm really thankful for the opportunity to spotlight the awareness of CPR. So I actually brought on a community partner who we've been working together for over 2 years now. Their name is Corazon Community Services. They're based in Cecil, Illinois. So just outside, just right there in a suburb, not too far from Chicago. And I really wanted to highlight them because they implemented, like many of my partners, all of them are great, don't want to leave anyone out, but this partner specifically implemented a cardiac emergency response plan, which means if anyone were to have a cardiac arrest, what is it that we do as an organization? And this also includes funding to purchase an AED on site. So really critical work, but there's so many barriers for any community-based organization to find the time, create a policy, get the funding, know the right steps, etc. But they really took it to a whole nother level, and I spotlighted them because now through our partnership, they're training around 30 to 40 youth every quarter and hands-only CPR. And it's just been so phenomenal. I've been so inspired by their work, and it just pushes me of like, who aren't we reaching when it comes to community organizations? Who lacks access? And that should not ever feel like an organization's fault. Like, well, I don't have the time, or I don't know what policy, or we don't have the funding. I think that's, in my personal opinion, where the American Heart Association can really stand up, and we have made a difference in closing those gaps and telling organizations, hey, we're here with you. All of those questions are valid, but that is not your burden. And that's actually where we come together in partnership. So that was a little bit, it was a 4-minute news segment. You know how fast it goes, but so happy we were able to highlight local community impact.
I love that. What a feel great story, and just really showcases your incredible partnership and the incredible leadership that you are putting forth every single day, Jocelyn. It really, really is inspiring. So, thinking about how far you've come in the last couple of years, especially, what advice would you give others on achieving or even going above and beyond to meet their goals?
No, absolutely. I would say, just to bring it back, like finding incredible educational spaces that, where you can learn and be challenged as well. I think we do need to be challenged because this work is challenging. So if you can sign up for opportunities like New to Public Health, other enrichment opportunities, it's where the magic happens, at least for me. So, I shared the example in the beginning of like my clinical work and being able to like quickly apply what I was learning into my work, into my approach, even the way in which I ask questions. Just it made me so much better because our partners, whatever line of work you are in public health, or even if you're not in public health, right, having a level of self-awareness, determination, and also hunger for knowledge, it just makes you a better person as well. So I would say, when it comes to anyone in public health, if you're like me and you didn't have a public health background, don't cut yourself out from seeing this as a career option. If you're in it, because now it's going to be almost 3 years since I first applied and joined Public Health. Um, if you're in it as well and you're just like, there is so much out there that I just feel overwhelmed or I'm not making the biggest impact, continue to stay plugged in to to public health community, your local communities, because at the end of the day, like I'm so blessed to wake up, even if it's answering emails, even if it's, something I'm challenged to do, like I get to do good in the world. I get to decide how I show up as a partner. I'm connecting with an organization that's maybe never done this work before and they're choosing to do it because they believe in it. You get to shepherd that and be that steward. What else can I really ask for professionally, right? So I just keep it simple with a lot of gratitude because we do get to make a difference and we can't be our limitation, is the last thing I'll say as well.
I just love talking to you, Jocelyn, so much because I love your attitude and your mindset of we get to do this. It is absolutely a privilege and an honor to be able to serve communities in as public health professionals and leaders. And I just think that's so cool. You said something to me once, quite a while ago now in conversation, in that recognizing that public health work is hard and that there absolutely are challenges, and it's free to be optimistic. And that is something that just has really stuck with me, and I feel like has come out of our conversation today, that I hope others also take away. And, you know, glass half full, how can we reframe this, and really have that like pleasure, intrinsic desire to keep doing this work over and over. And I think that that has translated to some recognition that you have received lately. I know in 2024, you were honored with the American Heart Association's At the Heart of It Rookie of the Year Award, which amazing work. And then since then, in 2025, you were also nominated for the American Heart Association National Equitable Health Leadership Award and received the American Heart Association 2025 Midwest Community Health Award of Excellence. So kudos for you. Amazing accomplishments. You're doing so much. Congratulations.
Thank you. Yes, well, again, have to bring it back to just literally my first week applying to Public Health, getting into the program, finishing it. It really taught me to be a student of my own organization, and also just to always be a student of public health, and taking that curiosity into any relationship, as I'm working with partners, working through challenges, we're hitting roadblocks, right? Of just like, what can I learn here? What can I offer to the table? And it's just like being a student. So I will say, like, my success, like those awards, wouldn't have come without the experience of New to Public Health, to you as well as a mentor, because I know I met with you individually a few times, be like, this is what I'm doing and I'm applying this and my capstone, and just being really in the thick of it. Like, this continues to be my anchor, and I know there's more that I can do as a public servant. I know there's more needed, and I don't feel overwhelmed by that. I don't feel disappointed that there's more needed to solve and to give to the world. Like, I feel energized that maybe I get to be someone who can make a difference. And like, what else can I ask for? So these awards are your awards too. The awards also goes to Lanier Public Health, because I wouldn't be here without y'all. I haven't had anything like this. This is truly unique. And I also haven't found something like this as well, like since then. So thank you truly for all your hard work as well.
Well, thank you, Jocelyn. It is, as you said, always about the people. So thank you so much for being with us today. Thank you for sharing your story. And I just can't wait to see what the future brings for all of us.
Thank you so much.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.